Welcome to Pharmacist Michael's Happy Healthy Living channel, where you will learn how to improve your life, one video at a time.
Hello everyone, I'm Pharmacist Michael, and today I'm going to talk about two different drugs for the treatment of anxiety. And those drugs are Xanax or alprazolam and Vistaril or hydroxyzine pamoate. And the reason I'm doing this is a lot of people ask me about Xanax and Vistaril on my TikTok live, so I thought I'd do a video. That way I can just point them over here and they can learn about these two drugs. Do you suffer from anxiety? Have you tried different therapies with no luck? Do anti-anxiety medications lead to adverse effects? We're going to, as I said before, compare Vistaril and Xanax for the treatment of anxiety. Did you know that anxiety disorders are the most prevalent mental health condition and cause a significant disability? According to the National Comorbidity Survey Replication, the lifetime prevalence of anxiety disorders in the United States is about 32%. Seems like a lot, doesn't it? It is not surprising that anxiety disorders can lead to a loss of productivity greater than other mental health disorders. Even though there are many treatments for anxiety symptoms, only 60 to 85% of patients experience at least a 50% improvement in their symptoms using current medical and psychological treatments. What are the symptoms of general anxiety? Feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, mind going blank, being irritable, having muscle tension, difficulty controlling feelings of worry, having sleeping problems such as difficulty falling or staying asleep, restlessness, or unsatisfying sleep. The symptoms of panic disorder are a little bit worse. Heart palpitations, a pounding heartbeat or an accelerated heart rate, sweating, trembling or shaking, sensations of shortness of breath, smothering or choking. A big one, feelings of impending doom, feelings of being out of control. So let's talk about Xanax or alprazolam. This is a benzodiazepine used for the treatment of general anxiety disorder and panic attacks. A lot of people take this medication for anxiety in the United States. Although alprazolam is an effective medication for treating anxiety, it does have some serious adverse effects. Some of the more significant unwanted side effects are confusion, problem speaking, poor balance or coordination, severe drowsiness, seizures, shortness of breath, respiratory depression, yellowing of the skin or eyes, severe skin rash. Alprazolam is also a controlled substance, which means it has a high potential to be addictive and abused. Therefore, other treatment options are preferred in those patients with a substance abuse history. The symptoms of withdrawal from alprazolam are as follows: sleep disturbances, irritability, increased tension and anxiety, panic attacks, hand tremor, sweating, poor concentration, dry heaves and nausea, weight loss, heart palpitations, headache, muscular pain and stiffness, seizures, psychosis. Even those using alprazolam as an anxiety treatment may become psychologically and physically addicted. Since this drug decreases abnormal brain excitement and produces a calming effect, it has a high potential for misuse. It also has a swift onset of action and a short duration, increasing its abuse potential and severity of withdrawal symptoms. As a medical professional, I only recommend alprazolam for the short-term treatment of severe anxiety. Xanax has a black box warning for risks from concomitant opiate use. The combination of alprazolam and opiates may lead to profound sedation, difficulty breathing, coma, and even death. Addiction, abuse, and misuse. I strongly suggest contacting a healthcare provider if you believe you are addicted to alprazolam or any other medication. One more interesting fact regarding alprazolam. This is one of the few drugs that I have heard patients complaining that the generic form does not work as well as the brand name. This may be an imagined phenomenon, but I've heard it from several patients. Now let's talk about hydroxyzine pamoate, which is Vistaril, an antihistamine that non-selectively blocks peripheral and central histamine receptors. This medication can be used for medical conditions other than anxiety, such as itching, nausea and vomiting, insomnia, and as an adjunct to surgery. As with any drug, Vistaril has side effects such as dry mouth, dizziness, ataxia, weakness, slurred speech, headache, agitation, nausea. More severe side effects of Vistaril include QTc prolongation, heat stroke, seizures, trouble breathing, hypersensitivity reactions. The recommended dose of Vistaril for anxiety in adults is 50 to 100 milligrams by mouth every 6 hours as needed. Unlike Xanax, Vistaril is not a controlled substance, but is a prescription medication. Hydroxyzine may interact with other anticholinergic agents, CNS depressants, and agents that prolong the QTc interval. Be sure to contact your doctor or pharmacist if you are taking other prescription medications before initiating Vistaril. So which medication is a better choice for anxiety? Both Xanax and Vistaril can help relieve the symptoms of anxiety. However, they both cause drowsiness and will interact with other CNS depressants, including ethanol. They are both prescription drugs, but Xanax is a controlled substance, so it is not suitable for those with a history of addictive behavior. In my professional opinion, Xanax is a better option for the short-term relief of severe anxiety and panic attacks. I believe it is more effective than hydroxyzine. Unfortunately, I was only able to find one study comparing the two agents in the setting of pre-anesthesia. This study came to the following conclusion. Alprazolam and hydroxyzine are both efficient and safe pre-anesthetic medications. However, a more pronounced, although modest, anxiolytic and the absence of side effects favors the use of alprazolam over hydroxyzine. Both alprazolam and hydroxyzine should be avoided during pregnancy. Xanax can be harmful to the fetus, and the risk of neonatal withdrawal symptoms and floppy infant syndrome can also occur. Xanax is a better choice than hydroxyzine when breastfeeding, according to Hippocrates. Hippocrates states, may use low doses of alprazolam short-term with breastfeeding. Otherwise, monitor infant closely. There is a possible risk of CNS depression in the infant when the breastfeeding mother takes alprazolam. What's my professional opinion? First of all, if you're pregnant or breastfeeding, I would always check with your doctor before taking any medications. I want to make that quite clear. Always check with your OB/GYN before initiating any medications that they do not prescribe. Anxiety can be a debilitating condition and can lead to poor quality of life in some individuals. As with most diseases, there is a broad range of severity in the various anxiety disorders. My concern is that patients will go straight to their provider and end up with a prescription to treat their anxiety when a drug-free alternative may work just fine. In addition, there are non-drug options available for anxiety symptom relief. One of these is CBT. Cognitive behavioral therapy is the most researched form of psychotherapy in history. CBT is a psychological treatment that helps patients recognize thought patterns that are contributing to their anxiety. I believe we are all prone to thinking errors. Suppose we can learn to recognize these and train our minds to think differently. In that case, we can decrease our anxiety and depression symptoms without introducing chemicals into our bodies. The other problem is that when we become anxious, these thinking errors become distorted and amplified, leading to more anxiety. I strongly suggest giving CBT a try before starting any anti-anxiety or antidepressant medications. The results will likely surprise you. If you don't have the time to spend in therapy sessions, there is a book I recommend reading. I've included a link to the book in the description section of this video. I've read this book several times, and it has helped me deal with my thinking errors, and it's helped many others do the same. We can also get better by lifestyle changes. Smoking, drinking too much alcohol, eating the wrong types of foods, and not getting the proper amount of sleep can all make anxiety symptoms worse. Exercise can significantly help. What about nutritional supplements? As many of you know, I am the owner of Sunshine Nutraceuticals. I believe that natural supplements are a vital piece of the health wellness puzzle. I also think that one of the possible uses of these supplements is to treat anxiety symptoms. If you're having a hard time coping with daily living or are considering hurting yourself, please call 911 and get help now. Regardless of how bad things seem, you can be helped. A person with a mental health disorder is no different than someone with heart disease, diabetes, or asthma. They just have a different organ of their body affected. Back to our two drugs. Alprazolam should not be used for the long-term relief of anxiety. As mentioned earlier, it can be addictive and has a short duration of action. We often use a benzodiazepine, such as alprazolam, while waiting for the long-term anxiety medication to work. To treat anxiety, the drugs we start with are antidepressants, specifically selective serotonin reuptake inhibitors, or SSRIs. These medications often take several weeks to show maximum benefit, so it's critical to have a backup. If you have any questions regarding this topic or any other subject, don't hesitate to contact me by sending me an email at michael.brown@sunshinentc.com. If you'd like to order our anxiety formula for Sunshine Nutraceuticals, simply click the link in the description section of this video. If you've enjoyed this video, please give it a thumbs up. If you know someone else who might enjoy this video, please send it to them. Please subscribe to our channel for more happy, healthy living information. I'm Pharmacist Michael. Be happy and be healthy.